Hello and welcome to this live and interactive web stream. I'm Kevin Harris. Official estimates are that 1.2% of the population suffer from OCD. However, new research released by Benenden Health reveals that more than 40% of people polled believe that they exhibit traits of the mental health illness, highlighting the real lack of understanding that many people have of the condition. Now, it can come in many different forms, but how serious is the condition, what can it lead to, and how can it be treated? Well, I'm pleased to say that joining me here today to discuss the answers to these questions and more is Beth Murphy, Head of Information from the charity Mind. Beth, thanks for coming in.
No problem. Hi there.
Now, don't forget, myself and Beth are live here today, so if you want to get in touch with us, please do. Use the box on your screen and send us your questions. We'll do our best to tackle them over the course of the next 15 minutes or so. And if you're tweeting whilst watching the show, use the hashtag, that is hashtag StudioTalkTV. StudioTalkTV, sorry. So, Beth, the survey's found that more than 40% of people polled believe that they exhibit some traits of OCD or, feel that they're, on their way to having it. That sounds like quite a high figure to me. So what can we learn from this research?
Sure. Yeah, I mean, we were quite surprised to see how high that figure was as well. We think it's probably to do with the sort of misunderstanding of what OCD actually is. So people will be quite familiar with some of the traits, things like, washing your hands, checking locks, making sure that an oven's been turned off. But they perhaps don't understand that those are quite common behaviours. Those are things that all of us do, and we might well check a lock 2 or 3 times. That's not a mental health problem. No. When it's more serious and more significant would be when sort of some of the other elements of OCD are also present. So probably the survey just shows that people don't really understand what the condition actually means.
It's almost like it's kind of in public speak, isn't it? People will do something, like you say, change a lock or straighten a mug or turn a plant on a thing and say, oh, it's just me, I'm just a little bit OCD. Yeah. But if I was actually suffering from OCD and I've been diagnosed that, I'd find other people saying those things quite belittling and sort of, not understanding what I've really got. Yeah,
I think that's definitely true. If you imagine it was a physical health problem, if it was cancer or something like that, you would never joke about it. So it's not really okay for people to make those sorts of comments.
So what is OCD? If we go from somebody, the difference between somebody just checking the lock a couple of times and somebody who's gone to the GP or mental health practitioner and been diagnosed, what is OCD?
So it's got 2 main parts. So most people will have obsessions, which are unwanted thoughts that come into your mind, negative thoughts. So that could be something like an urge to push somebody, in front of you, or it might be thinking you're contaminated or you're dirty, thinking someone in your family is going to be injured or is going to die. So really distressing thoughts that come into your mind and you can't get rid of them. And people then get anxiety as a result of those thoughts and then go on to develop these compulsions, these habits. So the things we were talking about, washing your hands frequently or washing yourself frequently, checking the oven's turned off, all of those sorts of behaviours. So it's made up of those 2 parts, and most people will develop the compulsions because of the obsessions.
Well, it's something that affects many people, as we've discovered, and earlier today we spoke to Emma from Northampton, who developed OCD after being involved in a car crash whilst pregnant with her daughter. Let's take a listen now then to Emma's story.
I was involved in a car crash in December 2005 where my vehicle was written off, and naturally as an expectant mother at the time, I also had my 18-month-old daughter in the back of the car. I was concerned for their well-being, and I developed OCD relating to security and safety of my children. Well, it started basically just with checking locks, windows, things like that, relating to their safety because of the car crash, but it continued to sort of be really extreme. I started checking light switches, appliances, and it wasn't just 1 or 2 times, it was 20 or 30 times. It was delaying me going to bed, me leaving the property, things like that. I was quite lucky because of my car crash. I was already seeing the GP, so they were asking how I was feeling. So I was explaining how anxious I was about driving, because I wouldn't drive after the incident, how anxious I was about vehicles and cars in general. And then I explained how I was checking things and really paranoid about something happening to the children again. I'm quite an open person, luckily, so I did explain thoroughly how often I was doing the things. It got to the point where I was literally checking items going in and out of the washing machine, counting them when I was putting on the washing line. It was really affecting my life. It progressed really quickly. From the car accident, it was literally hours within it happening that I was checking things, and then over a matter of days it got really severe. My hands were becoming red raw from washing them because I had a fear of germs, and it it just progressed from that, really. I still have it today, and that was 2005, but at the moment it's under control. I can live with it quite easily. They did offer medication, but that wasn't my first option. I was offered cognitive behavioural therapy as well. I didn't really want to take any medicine, so I opted for the therapy. It was very informal, the meetings. It wasn't sort of, I didn't feel as though they were judging me. I basically had to discuss what had happened in my life, talked about the incident, and then I just had to face my problems head on. They basically made me explain what I was checking and then tried to make me not check. So in time I learnt that I didn't have to check as often. I could leave the house without touching light switches and handles hundreds of times. A lot of people think that the symptoms are just quirks, like people will check doors and windows anyway, but when it comes to the point that you're washing your hands, you've got a severe fear of germs, or cleaning for hours of the day, or organising things in lines, counting regularly, or you feel a family member or friend is being affected by it but they won't come forward, then it's best to speak to them directly about it. Be really open, and also there is information and support available for you, so it's best to seek that.
So that's quite an interesting story there of Emma's. I mean, is that quite common, things like that, what you were listening to there?
Yeah, I mean, the kind of the reasons that people develop OCD are various, and they're not fully understood. So having a car crash and then developing OCD it's not something that I've personally heard before, but you know, it is something that obviously can come about.
It's an incident that's a trigger.
That's a trigger for something developing, and the anxieties that are sort of part of that experience, I guess, are what she was trying to cope with, and part of the reason that those compulsive behaviours then came on from it.
We've had a question in on that theme, which is quite good actually, so thanks to Linda for sending in your question. She says, I have MS and OCD. Is it possible that the MS could have caused the OCD?
Again, I guess I would have to say we don't fully understand what causes OCD, so there isn't one clear thing, there isn't one clear trigger, and for some people there doesn't seem to be anything that you could see as a particular cause. We do know that physical health problems and mental health problems often are associated, though, and that, you know, for people who have physical health problems like MS, you know, depression and anxiety can become quite common with that, and OCD is a type of anxiety disorder, so there may be a connection, but I wouldn't be able to say for sure.
There you go. Hope that helps you, Linda. Thanks for sending in your questions. Moving on then, I mean, how do we distinguish the difference between somebody, you know, being a little bit particular or fastidious, or just, you know, straightening the cup every now and again, to somebody who has got OCD? At what point do we say, yeah, that's what you got? So, I mean,
a doctor would do that by assessing and looking at the severity and the frequency of the symptoms. So it would be how often you're doing the checking and those types of behaviours, and also how severe the impact is on your life. So if it's not causing you any distress, if it's just a couple of times a day perhaps, and you're getting on with your life as normal, you know, it's probably not OCD. If it's more severe and more significant, and if you're maybe talking about some of these negative thoughts and perhaps you're not able to cope with them, and you're having these thoughts that you can't get out of your mind, that's when a doctor might well make a diagnosis. And
I imagine as an individual it's quite tricky to step up and go and seek professional help, but there must be family and friends who are kind of like watching members of their family or friends and thinking, I wonder if they're all right, you know. How do they spot it? How do they go about broaching the subject? Yeah,
sure. So I think it's quite difficult to spot the thoughts, because they're thoughts in somebody's head, and people might be embarrassed, they might not want to talk about them. But the behaviours, you know, if people are checking things, if they're washing more than normal, those things you probably will be able to spot. I guess the advice would be to speak to the person, you know, don't make assumptions, you don't necessarily know what's going on for them. It might be something that's distressing them, it might not be. So the first thing would be to, you know, educate yourself, perhaps read a little bit about the condition, maybe on the Mind website or OCD Action, one of these organisations, and then, you know, sit down and say, I'm worried about you, you know, you seem to be behaving differently, and let them tell you what's going on for them.
Yeah, it must be quite quite difficult to even, you know, get to that point to even talk about it, but that's the first thing you've really got to do, isn't it? You know.
I think it is, yeah, because otherwise, you know, you might make all sorts of assumptions about something and be completely wrong. So, yeah.
And I imagine as well, like, you know, self-diagnosis is probably quite a dangerous thing, because you can talk yourself into anything, can't you?
Yeah, definitely. I think with all mental health problems, people can, I mean, like this survey is showing, people can see symptoms and see them in themselves and then think, well, that must mean that I've got this condition. There's a reason that professionals make these diagnoses, and there's a reason that, you know, it's useful to get an objective opinion on these things.
How difficult is it for somebody who's suffering from OCD, or, you know, a member of your family, how difficult is it for them to break the cycle of what it is they're doing? Is it something that you can do, you know, within your family or indeed on your own?
There are some self-help techniques that people can try. They're based in a type of therapy called cognitive behavioural therapy, CBT. People might have heard of it. But with OCD, part of what you're encouraged to do and what the treatment will do is to expose you to the thing that you have a fear about. So expose you to the germs, that sort of thing. Doing that without professional help can be really dangerous, because it can actually make you worse. It can make you more unwell. So you know, if you're scared of dirt, you force yourself to be in a dirty place, that could have terrible consequences. So yeah, there are some things, but tread with caution.
Okay. We've just had a question come in from Jo Pimmer. Thank you, Jo, for your question. She says, do you think it's possible for someone to fully recover from OCD?
Yeah, I think it is.
Okay.
I think that recovery can mean different things to different people. So with mental health problems, recovery might mean that you're slightly different to how you were before you had the problem. So you'll always have a memory of having had that condition. You'll probably always have a little bit of anxiety and be cautious about certain things. But lots of people say that they actually feel much stronger and they understand themselves more and they feel much more able to face life once they've been through something like this. And the treatments for OCD are effective for the majority of people. So yeah, I think people can recover.
Okay, there you go, good news. A question's coming from Anxiety UK. It says, why do you think anxiety, particularly OCD, doesn't receive the same understanding other conditions like depression does? And what do you think can be done to change that?
I think it's possibly to do with just the lack of understanding, lack of education that we've been talking about already. So this, you know, for some reason OCD's made it into kind of the public sphere. People talk about it, but really don't understand it. So there's a little bit there about just everybody being more aware. There's probably something as well about, you know, the amount of money that's invested in the different types of treatment and different services. OCD, more moderate or severe OCD, does need specialist interventions, and there's only limited money in the NHS, and it's not always invested as we, the mental health charities, would like it to be.
Sure.
So there's probably something connected to that as well.
And what are your views perhaps on the current level of care that people would get if they go along to their GP? Is this something that GPs are going to take seriously, indeed understand and be able to diagnose?
I think we'd have to say it's patchy.
Okay.
I think some GPs will be excellent. They'll be, you know, really familiar with it. They'll be up to date with the guidelines. They'll know how to assess, how to diagnose. They'll have services in their area they can refer people on to. In other parts of the country, it might not be so good, and that can be down to your individual GP or the amount of money available in your area. Unfortunately, the NHS is not consistent, so there are places where there will be gaps.
Exactly. Great stuff. Thanks ever so much for your question. Do keep them coming. Like I said, we're kind of live at the moment, so there's still time to get questions in. It's hashtag Studio Talk TV on Twitter, or indeed use the box on your screen. So just kind of, you know, bringing it all together, what other help is out there? You know, there's support groups. I mean, can people find stuff on a local level, maybe outside of the NHS? Can they do their own research?
Yeah, definitely. There's lots of help. Often in the voluntary sector, there will be things like our local minds. Anxiety UK will run local support groups, OCD Action, similar. So the best thing probably is to look up the websites of some of these charities, maybe phone an info line. The Mind info line can refer people on to local support in their area. That would be for face-to-face support. There's also online support available. So we have a kind of an online, we call it a peer support community. So if you're struggling, you can log on, you can create a profile. It's a bit like Facebook, but it's much safer. And then you can talk about how you're feeling. You know, you can post a status that says today's been awful, and there'll be other people there who've been through something similar who can give you some support. Interesting stuff. Thank you ever so much. And just before we go, a final thing, if people have been watching this and any of what we've discussed in the last 15 or 20 minutes, if it's starting to ring true or just kind of making them stop and think a moment or two about themselves or a member of their family, what should they do today? Today, I would say read more about it. Go onto the website, read about OCD, phone an info line, phone in our info line, ask about it. And if you think that, you know, there's something wrong, then book an appointment, go and see your GP, and if they don't give you the treatment that you're entitled to, go and see a different GP.
Lovely. Beth, thank you ever so much. It's been great talking to you.
Thanks very much.
We only had 15 or 20 minutes today and we're out of time, but thanks for coming in.
Great, thanks very much.
So there you go. Thanks to Beth once again, Beth Murphy there from Mind, the mental health charity, and thanks to you guys for watching wherever you are. Now don't forget, if you would like to find out any more about OCD in all of its forms, then please log on to the website, which is allthews.benedenhealth.co.uk/OCD. And don't forget as well, you can get plenty more information on the Mind website, which is www.mind.org.uk. Thanks for watching. We'll see you next time. Goodbye.